Welcome everybody, good afternoon, and welcome to this webinar session on harnessing the power of data through dashboards. Please note that we'll be given a French session next Wednesday, the 15th of December. I am Mireille Chagnon, Capacity Certainty Lead at Blue Square, and please don't hesitate to reach out if you need any follow-up. Alex, you can continue with the slide. Thank you. Thank you. Actually, this session is the fourth one of a series of webinars called Digitizing Your Program Tools and Tips that aims at helping project managers, M&E managers to choose the right digital tools to monitor their program and leverage data, which is allowed by the digitization of programs. This webinar series is brought to you by Blue Square and IT for Life. So some words about those organizations. Blue Square is a company supporting the implementation and use of data systems in global health, not only. Also, it supports the organization it's working with by developing and implementing digital tools such as data collection tools, data visualization, data integration, and also data analytics and modeling. Blue Square solutions apply in diverse areas such as health financing, monitoring and evaluation, supply chain, geospatial management, as well as data science. Blue Square's clients range from international organizations and agencies, foundations, NGOs, and also ministries of health in the countries it operates. As for IT for Life is social enterprising, providing digital tools and services to NGOs, associations, and also social enterprises. Their services are around the implementation and deployment of collaborative work tools, as well as the implementation of management tools and specific development of web and mobile application, as well as medical data collection and decision support. As I said, it's actually the fourth session. You will find out the previous one on our Blue Square YouTube channel. So for today, your hosts will be Guillaume Deflaux and Alex Gadjon as speakers. Guillaume is the CEO at IT for Life, and Alex is a data scientist at Blue Square, and the facilitator will be Grégoire Lurton, data science lead at Blue Square. So the objectives of this session is to know the process of building a dashboard with your current data, and also to know how to plan for the development of useful dashboards, but they will tell you more about all of this. And so I give you the mic, guys, and I hope you will enjoy. Thank you.
Thank you very much, Mireille, for that introduction. So as Mireille noted, today's speakers will be Alex and Guillaume. I'll be facilitating, which means mainly I'll be taking your questions in the Zoom area that is dedicated to that. So on the bottom right of your window, Zoom window, you'll find this Q&A or section where you can send questions. Don't hesitate to shoot any question that you may have for us. And so I'll be facilitating the discussions after the Guillaume and Alex talk. Speaking of which, without any further ado, Alex will start telling you about how to get your data into dashboards, and at least the wisdom and stuff that we have while we are doing that on a regular basis. Alex, the floor is yours.
Thanks, Grégoire. Thanks, Mireille. Hello, everyone. Thank you for joining us today for our talk on From Data to Dashboards, a talk on the process of building dashboards to get the most out of the data that you have at your disposition. A few quick notes before we begin here. This talk won't go into details, the technical details, that is, of how to build a dashboard, specific tools used or specific technologies applied. That's for another time. Rather, we're going to be going through the process of planning, designing, and improving on visualization tools. The examples I present here might be a little more involved, a little more complicated than the first dashboards you build, and that's totally okay. I just wanted to work with some real life examples that we've developed here at the team at Blue Square. So let's start with why you might want or need a dashboard to begin with. It's a bit of a cliche at this point that many organizations now have more data than they know what to do with. Data that could potentially be useful to guide decisions or evaluate programs, but is stuck in databases or in Excel sheets, inaccessible to many stakeholders and difficult to use effectively, even for those that do have access. Dashboards are powerful, flexible visualization tools that allow users to engage with and understand and act on this kind of data. There are many uses for these kinds of dashboards, but a few of the common ones are as follows. So for one, dashboards are really good at keeping track of frequently updated data, especially when they're implemented in such a way that they update automatically. That means you and your users always have access to the most relevant information. Dashboards can help you interactively explore complex data sources with your team. They're not static graphs. You can change what variables are displayed, how they're plotted, and dive into subsets of the data. This gives you and those you share the tool with the means to interrogate the data without a lot of technical background required. And as I mentioned, they are a tool to share. So often they can be published freely on the web, which means they don't have to be limited to internal use. You can publish them openly, you can publish them to a restricted set of viewers, and that allows external stakeholders to get updates without additional publication or communications work for your team. Finally, they can help you just get simply ready to use graphics for reports or presentations. PowerPoints, written reports are a regular task for many teams, and reusing dashboard graphics instead of having to make custom graphs in Excel or elsewhere every time can help save time and effort. So today's session will follow our general approach to building dashboards from start to finish, from we think a dashboard might be useful here to implementation and improvement. I'll be speaking generally about the process and more specifically about one dashboard that our data science team here at Blue Square has been working on over the past few months and is regularly used and updated every week. This is our conceptual model, which we'll come back to later, and it has 5 steps. First, and perhaps most importantly, we define a use case. Then we prepare the data we'll be visualizing. We evaluate the existing visualization or analysis tools. We want to start with what already works rather than trying to reinvent the wheel. We build a first version of the dashboard itself. And finally, we and our stakeholders use what we built, see what works, see what doesn't work, and try to make improvements to make the dashboard as useful as possible. Step 0 in this process, before even collecting the data or opening a dashboard tool, is to figure out what you're trying to build. It's much easier to develop effective dashboard tools with a specific use case in mind. Or I might put that the other way around. It's very easy to build something that doesn't meet the needs of your users or won't be used regularly when you don't know what you want to use it for. The use case is really fundamental to how the dashboard will be built. It informs what data you need, how it needs to be prepared, how you think about communicating information, the kind of graphics you want to display, so on and so forth. So ultimately, what will help you define the content is precisely one specific situation where you see the dashboard being used. One such situation, one we frequently encounter, is dashboards for monitoring data. If you're interested in seeing the results from an M&E program, chances are you have a well-defined set of performance metrics. The main need, then, of this kind of dashboard is to get a clear understanding of these metrics. To put it another way, the key question here is, what is happening? As a result, these dashboards are built in such a way where they feature a couple of key figures that give an easily understandable picture of performance in just a quick glance. One example of this, not the example I'll be going into in further detail, but an example of an M&E kind of dashboard that we built at Blue Square is for the National Malaria Program in the DRC. What we see here is a heat map where each row represents a province of the country and each column represents a month of collected data. The variable displayed here, selected from the menu on the right, is the proportion of suspected malaria cases tested with a rapid test or with a microscopic test. And the color of the cells shows how each province is performing in relation to target values defined by the National Strategic Plan for Malaria. So this is not an M&E program in and of itself, but the approach to visualization reflects the kind of perspective you have when you're thinking about monitoring. The question of what's going on here. In just a quick glance, we can see that there are concerning trends in the province of Lomami in the last few months that perhaps merit further investigation. You see them in the yellow to red here in the middle of the screen, excuse me, on the right. But dashboards are interactive too. So first, in the previous view, we looked at each column being a month. We can filter, we can change the temporal aggregation as we have it labeled here into quarters or trimestre in French, and see the same data over a different period of time, but still with a monitoring perspective on what's going on. Another common use case is for data analysis. If the key question for monitoring was what is happening, the key question for dashboards that focus on analysis is why are things happening? This could involve data exploration or comparison of indicators that you have at your disposal and should be supported by more flexible or interactive tools. An example of this kind of approach comes from a dashboard, another dashboard that I'm not going to go into further detail here, but just a quick example, another malaria, national malaria program, this one in Cameroon. On the right, we see a heat map similar to the one shown in the previous example. But instead of showing one indicator for all provinces, we have used the filters that are in the row on the top to select 2 provinces that interest us in particular, and to select 2 indicators. The proportion of pregnant women that received an insecticide-treated bed net in the course of their prenatal consultations, and the proportion of health facilities in those regions that had stocks of bed nets. So the colors, once again, represent targets developed by or set by the Ministry of Health. And on the left, we have the same indicators plotted over time as line graphs here instead of as a heat map. Blue is the percentage of pregnant women who received a bed net, and orange is the percentage of facilities with stocks. What we see is that the indicators run in parallel. As facilities ran out of nets, the rate at which pregnant women received nets dropped significantly, and as the stock started to come back in late 2020, the rate at which women received nets picked back up. This may seem rather straightforward, but it's a useful piece of evidence in answering the question of why the rates of women receiving nets fell so severely in 2020, that hopefully decision makers could use to make the case for investing in logistics systems, improvements in logistics systems in this part of the country, for instance. The example we'll walk through together comes from the DRC as well. This time with data collected by the Epidemiological Surveillance Unit at the DRC Ministry of Health. This program tracks cases and deaths of some 24 diseases, infectious diseases, on a weekly basis at the district level, which is called a health zone in the DRC. And our partners there are interested in better understanding where disease outbreaks currently take place, how those outbreaks develop at a local level, how current infection levels compare to those of years past, and where the data themselves may be incomplete or implausible. On the bottom of the screen here is a screenshot of our input data, so the data collected by the surveillance unit that they have shared with us in Excel format. Each row contains information on cases and deaths for one disease, for one health zone, for 1 week of the calendar year. So once you have a good use case in mind, it's time to prepare the data for use in a dashboard. Data preparation can be a major chunk of the work of creating a dashboard. I only have one slide on this here, but it really could be a presentation in and of itself. Obviously, this depends on the quality and quantity and cleanliness of the data you're working with, but don't be surprised if there's a significant amount of work to do before you even enter into Tableau or Power BI, or whatever the tool is that you're using itself. Data prep is a blanket term that has many subcomponents, from collecting or accessing the data to cleaning it, calculating indicators based on multiple variables, like the proportion of suspected cases tested that we looked at a few slides earlier, and aligning and merging data from different sources. It's important here to remember that dashboards are a visualization tool. So a window into the information that your data contain. If the data are a mess, then the dashboard's going to be a mess too, and chances are it won't be all that useful. Clearly defining a use case, returning to the focus of step 0 that we covered just earlier, is crucial, is really, really key to collecting, structuring, and preparing the data in such a way that facilitates building the dashboards that meet your needs and those of your potential users. The data for our epi surveillance dashboard have already been collected, so that's not our responsibility, but they still require significant data prep. So first, they need to be cleaned. In the screenshot on the left, you can see that several of the province names are written with slightly different spellings or characters. And it's obvious enough to you or me that Kasaï Central, written with a space, and Kasaï Central, written with a hyphen, are the same province. But to a computer, those are two completely different things. And the computer then will treat them as different provinces, which is not what we want. So first, we have to fix that. And once that has been fixed, once those names have been cleaned, because we know that the epi surveillance team wants data plotted on a map, we have to merge the surveillance data with the geographic data, the shapes of the various health zones that will allow us to create such a map. Again, we run into problems with names and spellings. In the screenshot on the right, we can see that the clean names from the surveillance data with underscore data next to them are written in all caps and don't have hyphens at this point, while the names from the geodata are in title case and have hyphens. In order to align these properly, in order to get the merge to work, we have to correct these inconsistencies. Finally, we do some aggregation and calculation of indicators based on the values that come in the raw data set. So once we have a use case and once the data are prepared, the next step in our process is to seek out what tools for data visualization or data analysis already exist in the context you're working in. Chances are, if you're spending time and effort building something like a dashboard, there are already PowerPoint presentations, reports, or other figures and tables that seek to display the same data. There's really nothing to gain from reinventing the wheel here. So we recommend you start by replicating the existing graphs and visualizations. This has several benefits. For one, you avoid repeating mistakes that people who have previously worked on the problem have made and maybe have corrected. But more importantly, your target users are probably already using these tools and will have a much easier time understanding what you build if it resembles something that they are already comfortable using. So working off this base, you can then start to think about improvements. How can a dashboard's interactivity improve the static figure that was the initial inspiration? Dashboards can easily display multiple figures in the same interface. How might combining these graphs increase the user's understanding of the data that they're looking at? So the malaria program dashboard, the first example that I showed you is a great example of this. The heat map colored by progress towards targets wasn't something that we created out of whole cloth. At the beginning of our design process, we engaged with partners at the Ministry of Health and found that they had an Excel-based tool with colored cells based on indicator values that they use regularly and were comfortable analyzing. And it was with that in mind that we developed our dashboard view, which serves essentially the same function, but with the added benefit of interactive filters that allow you to easily look at data at the province or zone level, annually, monthly, or by quarter, or to filter the regions or the zones that are displayed. A kind of flexibility that the initial tool did not have, but with the same sort of visual language that our users were accustomed to seeing. For our epi surveillance dashboard, the example we're walking through, there wasn't much in the way of existing material. We were sent some maps, however, like the one on the slide here, that show in red the health zones that reported a case of a given disease. And we knew that maps were going to be important for the surveillance unit's monitoring of the country's health situation. So really, it was just this basic map view that we had in mind when we started our design process. So next, it's time to build the first version of the dashboard. Using the design case using the use case, defined in step 0, the data prepared in step 1, and the design ideas that come from the existing materials we just talked about, we built the dashboard, this first version you see here on the screen. So on the left, we have a map, obviously, a map of the DRC split by health zone, where each zone is colored according to the number of total cases reported over the time period that's indicated in the filter, just above the map on the left. On the right, we have a dual axis chart where the orange bars represent the total number of cases, and the brown line, the case fatality ratio, that is the % of cases that ended in death for each week of the year. On the top, as I mentioned, we have a few filters that allow us to subset the weeks and provinces of the country being visualized, as well as the disease that we are looking at. So pretty simple, but we started with what we had and we came up with a first draft based on those existing materials. The final step of our process is to enrich and to improve on the dashboard that we built in the previous stage. So this, it turns out, is much more important than the initial design and generally requires more time and more effort. A good dashboard is a dashboard that gets used. To understand what your users need, or potentially why your tool isn't getting used, we highly encourage you to engage with them, to participate in meetings where users present your dashboard results, to have a user walk through how they use it through their analysis process, or to reach out to see what works for people and what doesn't work for people. With this kind of feedback, the dashboard is going to evolve significantly. And that's good, because no first version is ever perfect. And the more iterations of soliciting and implementing user feedback that you're able to do, the better your product is going to become. In the case of our epi-surveillance example, we engaged with our partners at the Ministry of Health in Kinshasa and found that their primary need was not a quantification of how many cases were found where, as that can be biased by population distribution and other factors, but to see where case counts met their definition of an outbreak. So taking this feedback into account, we iterated on our work and built the following dashboard view, where instead of coloring by case counts, our map is green where there are no cases, yellow where there are some cases, but not enough cases to meet the definition of an outbreak, and red where there is enough cases, or where there are enough cases, or the case growth is such that the ministry's outbreak definition is reached. On the right, we have a heat map, again, of all reported diseases in the columns for all of the country's provinces, which are the rows, with the same color scheme as you see on the map. Red means there's an outbreak of that disease in at least one zone of the province. Yellow means there's cases of that disease for at least one zone of the province. And green means there's no cases in any zone in the province reported for that week of the year. This is a much better graphic than the one we initially put together. And it is updated and reviewed on a weekly basis by our partners at the Ministry of Health. We really only got to this point because of our engagement with our users. To see what kind of what this kind of view can, what kind of information this view can bring, let's look at the example of the Ebola outbreak in 2018-2019 in the DRC. So first week of 2019, one little health zone here is red. The one just here, if you can see my mouse, in the province of Nord Kivu, which you see is red here under FHA, which is the French acronym for hemorrhagic viruses like Ebola. A couple weeks later, you see outbreak spreading to other zones in the same region and crossing a province line. We have a case reported in Owerri, which is the next province up. a few weeks later, the cases are concentrated in the same sort of northeast area of the country, but starting to spread elsewhere, or perhaps indicated elsewhere for unrelated reasons. And finally, we can see as the cases grow, very, very clearly and very distinctly where the cases are and where the attention of the epidemiological surveillance unit and of the other response partners needs to be focused. To wrap up my section of the presentation, I'd like to step back and take a look at the flowchart that we started with that shows the steps of our dashboarding process. In the abstract, it's linear. So it's a process that starts from identifying a use case, goes directly to prepping data, to evaluating solutions, to building a first draft, and then on to using and enriching. But in practice, it probably looks something a little more like this. Each step of the process informs and impacts others. So it's less of a linear A, B, C, D than it is a loop that circles back on itself at various stages. So for instance, the use case might determine what data you need to collect if you don't have data already. But if you have data already, the data you have at your disposal might limit or reduce the use case that you present or you've ideated to begin with. Most importantly, the feedback that you get in the last step of the process must link back to the earlier stages in order to be taken into consideration and ultimately included in the next version of this iterative process. So to conclude my section here, if you can only take two things away from this talk, let it be this. Number one, a concrete use case is mission critical. Without that, you're going to be lost from the get-go, or you're going to end up creating something that you put a lot of time into that doesn't end up being all that useful. And number two, good design comes from iterating on your work. The more you engage with dashboard users, the better your tool will be and the more it will be used. That's all from me. Over to Guillaume.
Thanks, Alex, and thanks for the great insights. So we're now moving from the design of the dashboard to how you can better include that dashboard into your daily usage. And so Guillaume is going to present that section. And just a reminder that if you have questions or comments or things you want to clarify or to go deeper, don't hesitate to ask questions on the discussion or the Q&A section of the Zoom. Guillaume, go ahead. You're muted, Guillaume.
There we go. Can you guys hear me okay?
Yes.
Great. Alex, do you mind refreshing the presentation? I just fixed a typo. I just want to make sure we have the neat for everyone. So while Alex is refreshing, I wanted to come on to speak to what it means for your organization to get into using the dashboard. So Alex walked you through the whole process. You have data, now you have nice dashboards. The key thing now is how do you leverage these dashboards within your organization? Slide, please. So as what you need to do basically, in broad terms is what we call develop your data culture within the culture of data within your organization. So the idea is that you have the data, now you have to use it to do stuff with it. It's not enough just to have the data, you have to use it to take decisions, to orient your interventions, to define new intervention models, new things, right? To better, to leverage what the data tells you to improve your outcomes, basically. So what we do at IT for Life is that we support organizations also in not only as Alex has shown, as Blue Square does, create these visuals. I will admit what Alex showed you today is state of the art. So it's really, really incredible what they have been able to achieve, but also to develop that culture of data. So we've identified 6 pillars for this culture of data. First one is human resources. Second one, methodology, capacity building, the tooling, the data, and the infrastructure. Slide, please. So once you have the data and the dashboards, you should have something like tooling, data, and infrastructure already pretty much set up, but you need to work on your HR, methodology, and capacity building. So what does that mean? It means that you need to have the proper people in place in order to actually look at the data and do things with it. So these people have to be trained as well. So it means that by explaining them very concretely how to use the dashboard, how to leverage all the data they have inside of these dashboards. They will be able then to take better decisions and improve their operations. And finally, you need a lot of methodology in order to make sure that you have the right processes to look at the data, decide what you do with it, create the feedback loops within your organizations so that people who have not only created the data can also get some information back to them, and then use it as well at every level. So these are like that this can be complex processes, but there are ways for your organization to get that culture of data. And one let's say, I'm not going to say easy way, but one like let's say concrete way to do this is to work through what we call theory of change. So can you go to the next slide, please? So here, obviously, I imagine you don't see the detail, but what I want to show you is that for this particular partner of us, we devise a theory of change based on their current situation to see what areas of their organization need to be strengthened. And within these 6 pillars, here you can find the colors again. You can see that all the different components and all the different dependencies between each component. And what we do is that we work through them with the partners to on specific boxes, if I can say, to improve so that data can flow from the bottom to the up and have all the added value that you want. So it's important that when you look at how you can improve your culture of data, approach this in a very sort of like a pragmatic way. Identify what needs to be done on each of these 6 pillars. Try to find the dependencies. Build. This is maybe a complex theory of change, but you can go for something a little simpler. And from there, plan actions that will allow you to, make progress towards building that culture of data. And once you have the data, the dashboards, and that culture, then you really can have the full benefits of the information that your organization produces. Now, I want to take also a few minutes to sort of demystify dashboards. I think what Alex and Blue Square have shown you today is really state of the art. Working with ministries, Congo is a complex context. Lots of data come in. The data itself is complex to process. Many different data sources, and that obviously accomplishing this type of work requires you to follow each and every step that Alex explained. That methodology is really what will get you through the project and get you to success. Now, for organizations that collect data, I also wanted to show you a couple examples that you don't have to go through. It doesn't have to be super hard. You have to follow the steps that Alex explained. These are very important because that gets you to a good state. But it doesn't have to be always super complex. Slide, please. So I'm going to talk to you very quickly about an example where we work with one of our partners to build like a dashboard to follow up on a vocational training program. And the idea was to follow up, how many youths were enrolled, what the coaches were doing, and what are the local communities that were involved in this vocational programs also doing. So here, slide please, really simple analytical descriptive dashboard. So it's in French, but you get the idea, very simple metrics, pie charts, super simple. So very easy to build once you have the data, once you have done, follow all the steps of preparation and cleaning and all that stuff. But then you can come up with some very simple dashboards. You can go to the next slide. Simple, like lists, distributions, key metrics like this. This is super helpful for program managers, to see the progress of their projects and of their interventions. Yet it's not very difficult to produce. So I wanted to make sure that you understand that although you can go with this methodology, you can go to super complex and super complex dashboards. You can also apply this to get simple visuals that also will provide you high value. So in the next slide, so another one here, like on the distribution of local communities based on the region, you see a very simple graph. You don't even need to have a map. These kind of graphs on the right actually give you a good example, a good perspective on where are the most local communities. So another example, and this example is interesting because this is like a program. It's like a 3-year program, so it's routine data you will see on every week, every month. You will look at it, see where you're going, use it for reporting, all that kind of stuff. So, it's something you can take some time to build, you would say. So you have quite a few metrics, as you can see. I haven't showed you all the different metrics. It's just like maybe half of them. But still, you can invest some time in building the V's and the dashboards. But also, in many instances, you will want to have dashboards for something that, sort of like a one-shot activity. So here, I wanted to share dashboards we built for an organization that is currently performing, a nutritional coverage survey in Chad. And the idea is that every day they need to look at the data that was collected by the surveyors and see, how it's going. Like some key metrics around, how many supervisors, the percentage of supervisions that were done during the data collection, number of children, surveyed and household surveyed during the day, stuff like that. So that's done only for this specific survey. It's going to last for 10 days. And you would think that it's going to be hard to, build a dashboard just for this activity, but in fact, actually quite simple once you have the right tools and the data is there in a relatively clean way. It's a survey, so data, we work in a very controlled environment, so the data cleaning here is actually fairly limited. We don't need to do much. It's fairly good from the get-go. So here you can see, key metrics on the top: number of children, number of households, percentage of MUAC measurements done by supervisors. And then if you go to the next slide, you can also very simply build distribution charts here to see, are my surveyors actually, measuring the MUAC in the correct way for nutrition? This is one of the key measures. So is the distribution looking good? Here you can see spikes, on 0 and 5 rounding measures. So normal distribution looks good, but also you can add maps super easily. If you go to the next slide. There you go. So you can see a map of where your household you've surveyed. So does this match what you see in the data, etc. So again, this is like maybe 2 days of work to build this in preparation of the survey. So it's not a lot of work, and you can do this only for that survey. So again, wanted to demystify the fact that you can build dashboards if you have the right tooling in a very short period of time, and that gives you instant added value for your organization. So, and again, emphasizing that, the methodology we presented here today, you can apply it for very simple stuff, as I'm showing you now, or very complex things like Alex showed you that require many iterations. Either way, that methodology will get you through the process and give you the value you're looking for. That's what I wanted to share with you guys today. I'll give you back the floor, Grégoire, for the questions.
Thanks, Guillaume, and thanks for the presentations. So maybe to get started, we received one question, which I think is good for the both of you. The question is, when you have multiple or a lot of different things to show because you have multiple users, how do you combine? How do you include multiple use cases into one dashboard? Or how do you go around when you have to work with multiple stakeholders and to work on dashboards for those multiple stakeholders? So maybe Alex, do you want to get started? How you would iterate through different steps that you defined, and then Guillaume, if you want to address from usage perspective, how you would go around that question.
Sure. So I have two things to say here. First is, if you have two distinct groups of users, I would, again, strongly encourage you to sit down with both of them separately or together, or just to spend time and see how their use cases differ, how their use cases may overlap, and to really to base what you're building on evidence and feedback from the people that are using your tool. On the logistical piece of how do you include various use cases in one dashboard, most dashboards tools have pretty easy features for including multiple pages in one dashboard tool. So if you had one set of users that had a more monitoring use case and one set of users that had a more data exploration or analysis use case, those could be different tabs of the same dashboard based on the same data, but just representing and allowing users to interact with data in different ways.
Yeah, and just to add, super in agreement with what Alex said, I think always try to be careful not to over provide data, because then you might get lost into all these different visuals. Like you have to be very focused, so defining a use case here becomes key.
Thanks. So we have a raised hand from Yves, but I don't know if he can take the mic.
Just type your question maybe in the Q&A.
It's easier if you type your question. If Mireille can. So if no. So waiting for that question to be typed and don't need to it directly to me. I would have one question about the process of going from identifying a use case towards and ending up with a working dashboard. Typically, what is a time frame that you can think about for a dashboard where you have two data sources you want to work with, or one data source? How much time would you dedicate to each of the steps? Is there a sense of the investment that is necessary to get through this whole process? Maybe Guillaume, you want to start, and Alex continue to change a bit? Yeah.
Thanks. Well, I think it's going to be very, very variable depending on the actual data you have, the complexity of that data. So as I showed, in my last slides, literally like building this map took me approximately, 17 minutes, right? I won't say. So it's super easy because, my use case was super clear. The data, as I said, it's a service. So the data is pretty much 100% clean when you get it. And then, building it takes like, 10 minutes. So it really depends on the use case itself and on the quality of your data. I would say if we had to split in percentage, because I think this could be more relevant here, like as Alex said, 70% of your time, if you have like some good amount of data, will be spent on the data preparation step, because nothing will work until you have data that you can easily plot. So basically, data scientists, such as yourself and Alex, will basically will spend most of their time understanding the data and making it sure that the building part is easy, because as you're building this, it has to be simple in a way that people can understand. And if you want to iterate on the visuals, and again, you want to make sure your data is clean. So I'd say the main thing to take away is like most of the work is on the prepping of the data. Depending on your use case, this can be up to 70%. And and so you have to take this into account. So I think maybe the message here for me would be like, do as much as you can to get clean data from the get-go. So, your data collection tools, whether they're mobile or web or whatever, like invest time to make them, as robust as possible, so that what you get as an input to your, data pipeline is as good as possible.
Yeah, fully in agreement with that. And just to add one point to what Guillaume said, I would just emphasize that it's not so much a proportion of time or a specific prescription of how long each step should take, but that the sooner you get a first version out, the sooner you get feedback on it, the faster it's going to get better, and the faster it's going to meet the needs of the people that are using it. So I don't want to prescribe a timeline here, but again, the improvement comes from iteration. So don't spend too much time on getting a draft out the door.
Okay. I think one of the points, and giving, I recognize that's, very generic advice that you're giving here, and very generic point, but can you say a word about tooling? We've been, we've not gone a lot into tooling, but what would you say? What is it you're paying attention to when choosing to work with? People know Tableau, Power BI, do all the studio? Do people need to be able to script some work? What would be some generic advice that you could give to people that are having their data and want to move towards dashboarding in how they choose the tools here? Guillaume, you want to start?
Yeah, quickly. I think I'll go for the more simple answer, since I think Alex can go much more into details of the technical side of things here. And again, in this idea of getting things out quickly and solving not always the most complex problem, but I think the first thing is you need to, I would say, consider the full data pipeline from the get-go. So what are you going to use to collect the data? What are you going to use to store the data once it's collected? And what you're going to use to display this data? And when I say store, I also mean transform, because as you store it, you want to transform it to make it clean, and then you use it for the biz. So look at the entire pipeline, and the best situation for you is that you have, sort of like drag and drop type of like integrations between this whole element, all these elements. So you don't have to, you have to waste time integrating, plugging the pipe between these different elements, components of your data pipeline. If you have this, then I think, a lot of the work will be made easier, and the time to delivery will be reduced. It can be sometimes complicated to integrate different platforms together, because, the way the data is structured and the way the connections are supposed to happen can be tricky. And sometimes it's actually, there's no what we call APIs to connect them. But if they are, you should really use them. So I think from the get-go, think about the whole chain and make sure you get the most automated pipeline that you can think of, that you can get.
Yes, certainly. On the specifics of dashboarding tools, the good news, and maybe the bad news too, depending on how you think about it, is that there are a half dozen BI or data visualization tools that can all do the job very well. The bad news being it can be sometimes difficult to choose what the right one is. But in many situations, 3 or 4 will do the job equally well. So in our work at Blue Square, the determining factor in some of the projects we've been working on is what the teams on the ground are using already. So we've done some work in Ivory Coast, where they are well set up with Power BI, and it didn't make sense there to go in and use Tableau, which is something we've used mostly elsewhere in that situation. So I would say try to find the right balance of technical complexity, because the tools vary in that regard, with pricing and with what the users and what your team has experience with. On the data preparation side, yeah, this can vary widely depending on what you're working with, how big the data are, where they're coming from. A lot of what we do is using scripting languages, Python and R primarily, to automate the transformation and cleaning of large amounts of data. But that's because we're working with large amounts of data. If we were working with just results from a single set of surveys or something that is smaller and coming in less regularly, Excel or other manual cleaning, preparation of that data would certainly suffice. So kind of a soft response here, but really depends on the situation, depends on the tools that are available, depends on what the expertise is on your team. But the good news is most of them do quite well.
Maybe to complement this, what we've experienced, also supporting organization adopt these tools, is the 2 tools we've used most is Power BI and Google Data Studio. They will have pros and cons in either, but the good news is that you can do a lot of things with these tools without needing to go to the script level that Alex was mentioning. So, and in Power BI, you can even model the relationships between your different data sources, which is actually super powerful to make complex queries and complex visualizations, or say massage the data to display it in a complex way. So these tools, they sort of break the entry cost or the skills entry cost for your organization. So I would explore these if you have simple stuff to more simple stuff to do, and then as it said, is if you have more data, more complex transformation, more complex cleaning, then you will end up at the scripting level. Like there's almost no other choice.
Thanks, guys. I don't know if there are additional questions from the audience that you may think of wanting to address before we finish. We have a couple of minutes left, so don't hesitate to shoot additional questions in the discussions or in the Q&A section. If not, and I wonder, before we wrap up, Alex, if there is a final point you want to make to people that have been following that webinar, that are now think they have a good sense of what are the steps they need to go through and how they should think how to anchor the dashboard they want to build into their organizations. What would be the very first thing you do when you start working on a new database that comes in, and what would be your best advice on how to start working now and once they leave that webinar?
My best advice to start working now would just be to explore. I mean, one of the most powerful features of these tools is that you can, in a couple of clicks, create all sorts of different graphics with all the data that you have at your disposal. And the best thing you can do to understand what it is you're working with and to start to get an idea of what it is you want to build is just to start tinkering, I would say.
Great. Guillaume, what would be your last word and take on that?
Yeah, I think that's great advice. I'm not gonna try to say anything different. That's a great advice. Get your hands dirty.
Excellent. So I think we're done with this webinar. We hope it's useful. Don't hesitate to contact us either through the contact for that webinar, or you can find our addresses on our website. And we're looking forward to to hear from you, hear questions, and see how data will get used in the near future for all those different projects. Thanks everyone for your attention, and we wish you a good afternoon.
Thanks, guys.